So, good afternoon and welcome to Meet the Program and Faculty Path Days for the dental program. We have with us today Tara Swift, who is the chairperson of dental health, and she is also a professor of the dental assistant program. And also we have Julie Galshore, who is the program director for dental hygiene. Welcome.
Thank you.
Thank you for having us.
I don't know who would like to start today.
I'll go ahead and start.
Okay,
I'm just going to show a quick video. Hold on just 1 second. Sorry. For some reason, it's not allowing me to.
I came off of share, right? Yeah.
Not sure. Wait, hold on just 1 second. There we go. Okay, let me see if I can do it now. Okay. Can you see that?
Yes.
Okay, good. Okay. So this is just an introductory video on both the programs. Has some good information in it.
Looking for a challenging, rewarding career in an emerging field? Check out CCRI's dental health programs. We pair state-of-the-art technology and training with cutting-edge education to offer an associate's degree in dental hygiene and a certificate in dental assisting. CCRI's Dental Assisting Certificate is the only commission on dental accreditation approved program in the state, allowing our graduates to become Dental Assisting National Board certified more quickly. Take on expanded roles in the dental office at about half the cost of non-accredited programs in Rhode Island. Not only are there jobs available in our state right now, Rhode Island dentists prefer CCRI graduates because of our reputation of educated and skilled dental assistants. Already employed in the dental field, CCRI also offers continuing education opportunities for dental professionals. Find out more at ccri.edu/dental.
Okay, that's a quick little video. Let me stop sharing here. Okay.
Okay. So thank you for sharing that, Tara. I just
Sure.
have questions for you. So what courses do you teach?
I teach dental materials, the lecture and lab portion, chairside 1, dental assisting in the lab, and clinical externship coordination.
And your courses that you teach are part of the dental assistant program?
That's correct.
Okay, and that is different from the dental hygiene program, correct?
It is 2 separate entities.
So could you tell us a little bit about your program?
So our program is 1 academic year, and it's basically, learning to assist the dentist and just work within a dental office.
Okay.
There's no prerequisites, but there is a process for getting into the program. You have to apply.
Okay. Great. And what kind of students do you think that would excel in the dental assistant program?
Somebody that likes variety, somebody that's organized, team-oriented person, and obviously, working in somebody's mouth and teeth and all of those things.
Okay. What drew you to the field when you first became a dental assistant?
I like working with people. I like educating people about oral health. it's a great career. I love that not every day is the same, depending on the patient, depending on what is happening that day. It's just a very wide variety of skills that you also need to know and learn. So it definitely is not boring.
Awesome. And so for these students that complete the dental assistant program, are there many jobs available for them?
There's a huge job market in Rhode Island, especially right now. There's I have offices asking weekly if we have anyone available that's graduated yet, or I know of anybody else. The demand is very high right now in Rhode Island.
Awesome. And do they go actually out to the dentist's office for their internships or just field experience?
They do, absolutely. So the second semester is basically 15 weeks of externship along with some of the other courses within the program that they need to take. But they spend about 300 hours over the semester in a dental office. Usually it's 3 different ones for 5 weeks, just to give them a wide range of experiences.
Great. Okay. All right. So I think I'd like to go over to Julie as well. We'll just bring you in as well, so we can talk about the dental hygiene program.
Yeah, so I created a PowerPoint to go over a little bit quickly, and then I figured I could answer your questions.
Sure.
Wait, I'll share my screen. Is it showing up now?
Yes.
It's not. There we go. Okay. So I have a little bit of dental assisting in here as well. I've done pathways before, so I kind of have just like what we've talked about with students. So I usually look at like for students to ask themselves some questions that can help them decide whether they would like to be in dental assisting or dental hygiene and have a dental health type of career. So do you like to work with people? Do you like to work with your hands? Do you want to work as a team member? All the things that Tara said earlier, all the things that she liked about it. And, you know, do you want to help people be healthier? And I always say to students, if you said yes to this, maybe dental careers is the right fit for you. So you need to, you know, I tell students all the time, you need to look at your abilities, your strengths, and your weaknesses to determine if this field is going to work for you. And there are certain abilities that you have to be able to go into these fields. So we look at things like, you know, are you good with your hands? Are you good with, you know, being able to apply different knowledges quickly on your feet? Are you sensitive to how, you know, people communicate? And are you a good communicator with those, you know, to eventually with patients? Dental assisting, as Tara had mentioned earlier, you're working with the dentist, you help to prepare the rooms and work with instruments, and you teach people as well how to take care of their teeth. There are ways, again, to become an assistant. For our program, it's a 9-month program. We go from September to May. You have to pass a dental assisting national board to be a certified dental assistant. There are 3 components to that examination, which is infection control, chairside radiography, and then you are a certified professional. In dental hygiene, we have we're a part of those teams of team members together. So assisting and hygiene work together in offices. It is a 2 or 4 year program. Ours is a 2-year program. We do have a lot of prerequisites to get into the program. So some students will take their time taking those prereqs, and it will end up being sometimes 3 or 4 years based on how long it took them. For licensure, clinical, theory, and local anesthesia, and then you become a licensed professional. So you have to sit for boards as well. How do you come into our programs? Well, you can see here from high school, we have classes that you can actually take in high school. You need to sit and take AccuPlacer testing at CCRI, or you can use your SAT scores, and they'll look at your high school transcripts. And prior to being accepted into dental hygiene, you need to have taken one of our intro classes, which is Dent 1000, Introduction to Dental Health Careers. And we give them all year long. We have fall, spring, and summer sessions. We have daytime sessions as well as full online sessions for that prerequisite. And then you also have to take anatomy, physiology, biomedical chemistry. So again, what's the program of study? Well, you can see all the classes here that you would be taking. So if you think about microbiology and histology, a lot of people don't realize there's even statistics in some of our classes that there's that much that a dental hygienist and dental assistant actually have to learn. And then what are the opportunities for you? So like, as Tara mentioned earlier, there's a big need right now for both dental assisting and dental hygiene. We're getting inquiries all the time, but these are some of the job placements that you could actually work in those fields. So, I mean, people don't even think about, like, I actually could work for a veterinarian or in zoos. Yes, you could. You might be cleaning the dog's teeth right there and then. You are not your own boss. You do work for a dentist. We do have for dental hygiene another licensure level, which is called the public health dental hygienist, and they can own their own business but still have to work collaboratively with a dentist. I always look at, we work as a team together and we work with other professions. So we have interdisciplinary, interprofessional education as well, where we work with physical therapists, nursing homes, and other safety net providers that are out in the community. And what are some of your responsibilities in the field? You can see that you have to do medical and dental histories, you have vital signs, you're examining the patient, you're coming up with and assisting the dentist in their treatment planning, and all of these, you take radiographs. And for hygienists, we can administer local anesthesia and do debridement. Dental assistants and hygienists can do sealants and fluoride treatments, take impressions, pour models, and again, disinfecting the equipment and maintaining equipment. So I usually say to the students, continue to keep an open mind for opportunities that are available to you and find out what interests you. The college has different career options and career placement testing that can actually assist you in this. So I know you had questions for me.
Yes, thank you for that. That was very informative. So I would ask you the same question. What courses do you teach?
So I'm in a variety of classes. I do the introduction, Dent 1000 to Intro to Dental Health Careers. I do an online version as well as the summer sessions. I teach dental materials for dental hygienists. I teach their dental and oral anatomy for hygiene. I teach local anesthesia, medical emergencies, and I also coordinate one of the clinicals.
Okay, thank you. And what drew you to the field of a dental hygienist?
Just like Tara, I like to work with people. I always want to help somebody be healthier. And I was always interested in teeth. I had braces growing up, and I used to ask tons of questions to my dental hygienist and the dental assistants in the offices. And I actually worked for an office just filing things, so I could kind of get an idea when I was in high school if this was the right fit for me. So I'm really working with people.
Great. And so what would you recommend for a student to decide if they were trying to decide between dental assistant or dental hygiene? How would they know which path would be right for them?
I think Tara can also answer this too, but for myself, what I usually say to students in Dent 1000 is, see what you would like to do. If you would rather work you know, chair side with the dentist, because as a dental hygienist, you're more independent in the office, where you're not working with the dentist all the time. The dentist comes in and might, you know, do an exam with the patient, but you're pretty much in your own operatory. Where for a dental assistant, they have independent times where they might be, especially for certified dental assistants that have come through our programs, they have the opportunity to work with the patient chair side as well, but work primarily with the dentist, and they don't have as much independence as the hygienists do. So I kind of think along those lines, you know, do you want to be either way?
And then you said for admission to your program, the prereqs that they need before they can apply to dental hygienist? Could you just
Yeah, so we have A&P1 and A&P2 in the college. They have to take those 2 classes. They also have to take their chemistry. And then we also have that Dent 1000. So when I've advised students that have contacted me, I've told them, like, you know, if you're not sure, even before you take all the other prereqs, take at least the Dent 1000 class, because that can give you an idea of, we discuss dental assisting in there and dental hygiene. We talk about the field in general. We give them some terminology to learn, so that they can kind of get a grasp or an idea of what they're heading into before they leap and make that decision. So people right out of high school, or even in high school, can take this class.
Great, thank you. This is very informative, so I'd like to thank you both for coming to Path Day today. And before we leave, I just want to give a shout out. I'm going to share my screen. So this has been recorded. So if anyone has any further questions, they can find this recording at ccri.edu/pathways/pathdays, and to find out about each of these paths from that site as well. Additionally, next week, we're holding a virtual job fair. So you can see here that we have the link to that, and that will also be posted on the academic path webpage at the college as well, for those who are interested in joining us on that. Thank you again for your time today, and have a good day.
Thank you for inviting me.